of our clients, Susan, that we worked with wants to know how we can turn tips here into changing laws. And that's what we're going to talk about today. My name is Patrick Hutzel from intensivecarehotline.com. This is another quick tip for families in intensive care. So Susan says, hi Patrick, how can you turn your quick tips for families in intensive care into changing laws? I spoke with you and your team a few months ago about my brother, who they were trying to discharge from an ICU in a coma to LTAC or anywhere we would allow them to. Fortunately, I was able to get hospital administrators involved, and he was moved to another unit in the hospital. However, in retrospect, he should have stayed in ICU until he woke up from the induced coma he was put in. From Susan. Absolutely, and that's what we always say, that clients or patients need to stay in ICU until they are weaned off ventilation, tracheostomy, and then go home. The only alternative there is with intensive care at home, assuming a client or a patient is medically stable on a ventilator with a tracheostomy. In any case, thank you for the update on your brother, Susan. I am really glad to hear that you were able to advocate for him and get him transferred to a safer part of the hospital instead of LTAC. And you're absolutely right. Patients in medically induced comas often require the highest level of monitoring and maintenance, nursing care, just day-by-day management of ADLs, activities of daily living, that they can't be discharged to an LTAC. And therefore, discharging them to an LTAC, for those of you who wonder what's an LTAC, it's a long-term acute care facility, which are, by the way, only available in the United States, not in any other countries, as far as I'm aware. So if you discharge them to an LTAC facility too early, it can be dangerous and inappropriate. And I argue it's always dangerous and inappropriate. There is no right time to send a patient on a ventilator with a tracheostomy from ICU to LTAC, because it is always dangerous and not appropriate. So, turning your experience and other families' experience and the hard-earned lessons from it into meaningful change, including potential changes to laws or policies, both possible and also powerful. Here's a step-by-step guide on how to start. Number one, document the problem clearly. And I'm doing that here. I'm documenting here very clearly in my blog, in my YouTube videos, what the problem is. Because all the content that I'm making here and recording here, it's all user-driven. As you can see, I'm reading out emails from clients, reading out emails from members, discussing cases from members. So it's really important that you keep doing that, right? So document the problem clearly. Write down what happened, what almost happened, the risk of early discharge in a coma, what you did to intervene, what should have happened, the standard of care you believe should be in place, and the outcome. This becomes the foundation for a personal case study or a public story to raise awareness. Once again, that is what we are doing right here. But I also need your support to help me with that. You got to keep your case studies coming, and you got to keep asking for help when you have a loved one critically in intensive care, because if you're not doing that, you'll be doomed. Number two, identify the policy or legal gap. Ask, what allowed this to happen? Was it a lack of regulation? Is it a loophole in hospital discharge procedures? Is it inadequate standards for ICU transfers? Also, is it you as a family that is not informed about your rights? The biggest challenge for families in intensive care is that you don't know what you don't know. You don't know what to look for. You don't know what questions to ask. You don't know your rights, and you don't know how to manage doctors and nurses in intensive care. We see that all the time. Next, is it inadequate standards for ICU transfers? For example, there's currently no law requiring ICU patients to remain in that unit while in a medically induced coma if insurance stops covering it. Big problem. However, I also say that we have successfully advocated for families to keep their loved ones in ICU as long as it's medically and clinically appropriate, right? And also, while we're talking about hospital discharge policies, I argue Every hospital or ICU discharge policy will say that a critically ill patient cannot leave ICU and go to an LTAC without patient or family consent. And we have proven that over and over again. So a lot of it comes down to your level of education. How much do you know? How far are you prepared to go? Are you prepared to go to hospital executive? Are you prepared to go to the media? And the list goes on. Number 3, connect with advocacy groups such as intensivecarehotline.com. You certainly don't have to do this alone. Many national and state organizations work on improving patient safety, hospital accountability, and long-term care standards. Some examples are intensivecarehotline.com, but also national patient advocate foundations, Center for Medicare Advocacy, public citizens, health research groups. We and those organizations can help you package your story, develop policy proposals, get legal insight, mobilize others. Right? And also I would include the media here as well. Number 4, engage legislators. Start with your state representative or senator. Bring them your documented story and a simple ask, i.e. introduce or support a bill requiring medically induced coma patients to remain in ICU or step down ICU until they regain consciousness unless there's a medical justification. Legislators often respond to real stories with a clear injustice, right? We always advocate for that here, that you should go to your local state representative or government representative or senator. Next, I already mentioned it, but I want to mention it as a standalone item. Use public pressure and media. Write an op-ed or personal essay for a local paper or national platform. Share your story on social media with a call to action. Consider doing interviews, especially if others have faced similar treatment. And I offer you here to get on my podcast here at intensivecarehotline.com. I have done podcast interviews at intensivecarehotline.com, and you can watch those podcast interviews with families of critically ill patients in intensive care at our podcast section. Number 6, propose a concrete rule or policy. Even if you can't change a state law right now, you can push for hospital policy changes at a local level, 100%. That is the low-hanging fruit here. State health department guidelines, Medicare, Medicaid, and other health insurances administrative rule update. There's a lot you can do. But, we can't do it without you. You need to keep talking to us, and you need to seek help for families, for your loved one in intensive care on day 1. If you're not doing that, you'll be fighting an uphill battle, and you're almost losing ground by the minute. So, I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care. And I've been consulting and advocating for families in intensive care since 2013. And I can very confidently say that we have saved many lives for our clients in intensive care. And you can verify that on our testimonial section at intensivecarehotline.com, and you can verify it on our intensivecarehotline.com podcast section, where we've done client interviews. They will sharing their experience. Because our advice is absolutely life-changing. We have helped so many families in intensive care to save their loved ones' lives. That's why it's life-changing. And you can join a growing number of members and clients that we have helped over the years. As a matter of fact, we have helped hundreds, if not thousands, of families in intensive care here at intensivecarehotline.com. Once again, have a look at our testimonial section and have a look at our intensivecarehotline.com podcast section. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. When I talk to doctors, and when I talk to you and your families directly, I also talk to doctors and nurses directly if you want that with you on your behalf, or on a 3-way call, or I set you up with the right questions to ask. Because I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org. Directly in the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I have personally written and recorded. And all of that will help you to make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next or what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification for the YouTube live if you're a subscriber to my YouTube channel, or if you're a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.